Before MRIs, ibuprofen, or even basic hygiene, people thought the best way to fix migraines, epilepsy, and possibly just a bad attitude was to chisel a hole straight into the brain case. And the craziest part, some of them survived. Trepanation is the oldest form of surgery we know about, with evidence going back at least 7,000 years. We've found trepanned skulls all over the world, from ancient Peru to China, from Bronze Age Europe to Africa. That means for thousands of years, across multiple civilizations, people kept looking at a sick or injured friend and saying, "You know what might help? A hole in your head." The process wasn't pretty. There were no fancy scalpels or sterile operating rooms, just sharp rocks, flint knives, and an enthusiastic practitioner who, let's be honest, was probably winging it. The patient, likely awake for the whole thing. No anesthesia, no painkillers, just good old-fashioned agony. First, the surgeon, if you can even call them that, picked a spot on the skull, often near a fracture or an area associated with pain. Then came the fun part, cutting, scraping, or straight up boring a hole into the bone. If scraping was the method of choice, it took hours to wear the bone away, all while the patient screamed, bled, and probably regretted all their life choices. The more ambitious practitioners used a circular cutting method, gradually working their way through the skull until a chunk of bone could be popped out like a champagne cork. This left the dura mater, the membrane protecting the brain, exposed to the open air, which is exactly as horrifying as it sounds. Blood would have poured freely from the wound, mixing with chunks of skull and brain goop. The smell? Oh, just a lovely blend of iron-rich blood, sweat, and possibly a little singed hair if they tried to cauterize the wound. If the patient didn't die immediately from shock or blood loss, the real danger was just beginning. Against all odds, a surprising number of people survived this medieval migraine treatment. We know this because archaeologists have found trepanned skulls with clear signs of bone regrowth, meaning some patients lived for months or even years after their impromptu lobotomy. In some cases, success rates were as high as 78%, which, to be fair, is better than some modern politicians' approval ratings. Surviving didn't mean thriving. Post-op care was non-existent. Infection was practically guaranteed, and even if you avoided dying of brain rot, you were left with a permanent hole in your skull, prime real estate for dirt, bugs, or the occasional unlucky bird looking for a nest. So why did ancient people think this was a good idea? Well, theories vary. Some believed it released evil spirits, which is ironic, because if someone drilled into my head, I'd probably start seeing demons too. Others thought it was a treatment for epilepsy, head trauma, or mental illness. In reality, they were probably just making things worse, because if you didn't have brain damage before the hole, you definitely had it afterward. But not all trepanations were medical. Some cultures performed them for ritual reasons, possibly as a rite of passage, or a way to reach an altered state of consciousness. Modern medicine has refined trepanation into craniotomy, a sterile, precise procedure used to treat brain conditions like tumors and hemorrhages. But, and I wish I were kidding, some people still do DIY trepanation today. A small group of enthusiasts believe that drilling a hole in their skull improves blood flow and enhances consciousness.
Electric-powered flexible shaft drill to do my operation, which I had hung up above my head in a comfortable position so that I could reach up and hold that drill bit handle comfortably.
In my case, I started with the hand trepan and progressed, which is a lot easier with electric, especially doing it to yourself. It's like trying to uncork a bottle from inside it.
I went ahead using the sequence of drill bits, a pilot drill, a larger, faster cutting drill through the first layer of bone into the spongy inner bone.
If you're thinking that sounds like a terrible idea, congratulations. You have more medical sense than a 14th century barber surgeon. Trepanation is one of history's most terrifying medical practices, but it's also a testament to human resilience, or perhaps just our collective inability to come up with better ideas. Whether it was done to release demons, cure headaches, or just because someone felt like experimenting, one thing is clear: ancient medicine was a nightmare factory. Thanks for watching Gross History. Be sure to smash that like button, subscribe, and hit the notification bell. Because next time we'll be digging up even more horrifying medical history. Until then, try to keep all your skull bones exactly where they are and stay curious. But most of all, stay gross.